What is healing like after eye bag surgery?
Puffy eye bags are very common, which is why cosmetic surgery for under eye bags is one of our most popular procedures we perform in our practice. Under eye bags are seen in younger to older people, regardless of gender and ethnic background. Eye bags are essentially fat compartments which have herniated forward, causing a bulging appearance in the lower eyelids. Cosmetic lower eyelid surgery is the most definitive way to address these herniated fat pockets. For many people who I see, this is the first time they've had to consider an elective cosmetic surgical procedure. In addition to concerns about safety, people are very concerned about the healing process after surgery. I'll discuss what I do to help my patients recover as quickly as possible, in addition to making their experience comfortable and convenient. I'll also discuss how I perform the procedures so my patients look natural, as if they never had under eye bags. I'm Dr. Amiya Prasad. I'm a diplomat of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I perform lower eyelid surgery to help people with under eye bags in my practice, most often using the transconjunctival or from behind the lower eyelid approach. I perform a lot of revision lower eyelid surgeries originally performed by other doctors to address complications such as lower eyelid retraction. I also perform cosmetic upper eyelid procedures for hooded eyes, as well as specialized oculoplastic procedures like ptosis surgery or surgery to lift drooping upper eyelids. An additional example of what I do is surgery for eyelids affected by thyroid eye disease. Many people who are aware of puffiness around the eyes, they feel that it can be caused by lack of sleep, salt intake, allergies, and sinus issues. This type of puffiness is more fluid related, while puffiness under the eyes that's constant regardless of sleep and other possible causes is from prolapsed fat. Now, fillers can be helpful to camouflage minimal fat prolapse. I help a lot of my patients with tear trough filler to improve the appearance of hollowness adjacent to prolapsed herniated fat. It's interesting that a lot of people perceive hollowness and don't recognize the presence of prolapsed fat as a significant factor contributing to the contrast, making the hollowness look even deeper. Another way to think about it is that there's a deep valley next to a mountain or a mountain of fat. Although camouflage with filler can be useful, the more definitive treatment is to address the prolapsed fat surgically. Since the beginning of my practice over 25 years ago, I focused on optimizing surgery to make these procedures more accessible to a wider range of people. Essentially, I focused on the aspects of surgery that could be improved to reduce risk and to reduce recovery time. For under eye bags, I use a specialized approach called transconjunctival blepharoplasty. What I do is I sculpt the fat pockets that cause the eye bags from the inside of the eyelids and avoid any outside or external incisions or scars. The assistants who work with me are very experienced with these procedures I perform, and this means that there's no time wasted during surgery, and this allows the patient to have a much shorter operative time. Our postoperative protocols are administered also very efficiently. The type of anesthesia is another major factor that contributes to recovery. I perform all my eyelid surgeries using local anesthesia with light IV sedation. my patients avoid the risks and prolonged recovery typically associated with general anesthesia. When I first started my practice using local anesthesia for eyelid surgery, many other surgeons were disparaging me, only to later, or much later, acknowledge the safety of local anesthesia and the advantages of light sedation. Our patients typically return to work about a week after surgery. Generally, there's little to no bruising, which ironically is far less than the degree of bruising endured by people who get filler injections performed elsewhere in their effort to avoid having surgery. After healing, it appears like you've never had eye bags, even up close, because there is no external incisions. In my experience, this approach has many advantages over more traditional external approaches. Many people who have lower eyelid surgery from an external approach end up with rounding of their lower eyelids because of a combination of compromised support structures of the eyelid and skin shortage from skin removal in an attempt to achieve skin tightening. When this happens, the shape of the eyes change, and many people feel like they just don't look like themselves anymore. I actually perform revision surgery to correct these problems from what's called a transcutaneous or external blepharoplasty, originally performed by other doctors. The approach I employ by performing transconjunctival blepharoplasty, I'm able to preserve the natural anatomy of the eyelid, thereby preserving the character unique to your eyes. If there are under-eye wrinkles, I treat the real issue, which is diminished skin quality, not excess skin quantity. So instead of removing skin, I perform procedures such as fractional CO2 laser, PRP treatment to the lower eyelid skin. In my practice, recovery after cosmetic lower eyelid surgery can be minimally disruptive, and you can appreciate as early as a few days not having under-eye bags. I often say that the results are like you had a facelift, where the whole face looks brighter and more rejuvenated when you don't have bags under your eyes anymore. In fact, many of my patients have expressed that if they had known that the procedure had been so straightforward an experience, they would have had the procedure much sooner. I hope you found this information helpful, and thank you for your question.